Hi, everybody. Welcome. I'm Judy Newton, the chairperson of the Levy Senior Center Foundation. And welcome to all of you to our first webinar of the new Levy Longevity Series. The Levy Longevity Series is presented in conjunction with AMITA Health and the City of Evanston. Here we will all discuss common issues of concern for adults 55 and better. But more importantly, our mission is to come together to learn, to share stories, and to help us all age well. As always, we appreciate your support of the Levy Senior Center Foundation as we continue to grow and work to connect our community of older adults. A special thanks to AMITA for embarking on this journey with us. We are excited to kick off the series today with a special question and answer session dedicated to the COVID-19 vaccine. Our expert today is Dr. Jonathan Max, who will be answering questions that have been submitted by older adults in our community about the COVID-19 vaccine. And again, thanks to AMITA for partnering with us on this exciting program. And now I am happy to introduce Sam Cochran. She is our moderator today and also AMITA Sports Medicine Outreach Liaison, and she will introduce Dr. Max. Okay, here goes. We're launching. See you later. Bye-bye.
Thank you, Judy. As Judy said, my name is Sam Cochran. I am an athletic trainer by trade, and I am the sports medicine liaison in the Chicago metro region with AMITA Health. I'm going to start off by going over some housekeeping items. First of all attendees are muted for the duration of the presentation. Questions may be submitted using the Q&A feature in the bottom center of your screen. Please do not use the raise hand feature or attempt to unmute. We will not be able to see or hear you. Next, at registration, you were able to pre-submit questions. Similar questions were grouped together and addressed in the presentation. Additional questions will be answered at the end of the presentation during the Q&A portion. Additionally, it is not permitted for this presentation to be recorded by attendees. However, it is being recorded and will be available on the Levy Foundation YouTube channel and website. Lastly, this presentation is intended for information purposes only and is not intended to replace individualized care provided by your respective doctors or practitioners. AMITA Health and Levy Foundation are not liable for the misuse of any information presented today. Now, I would like to introduce you to Dr. Jonathan Max. He is the Regional Medical Officer for AMITA Health Medical Group and specializes in internal medicine as well as geriatric medicine. Dr. Max, I turn it over to you.
Thank you, Sam, and welcome everyone for joining me today and joining the Levy Center. A quick thanks to the Levy Center and to the Levy Center Foundation for co-sponsoring this first of many fantastic seminars. So with further ado, let's get started. Today, we're going to discuss COVID vaccines in the setting of seniors. And you'll see on your slide and in front of you that we're really focusing on the latest and greatest with COVID-19 vaccines, because this is bound to change over time, and that's okay. But we should focus on what we know right now as of this week. So here's a little bit about me. I am a primary care physician with AMITA Health Medical Group. I specialize in both internal medicine, which is the practice of taking care of adults, as well as geriatrics. A lot of people ask me what geriatrics means for me, and I tell them that geriatrics is really the study of aging and how we can age successfully. I'm a lifelong Chicagoan, born and raised in the city, staying around here for college and medical school. I lived in the city of Evanston for many years during my college days at Northwestern and while I was at Northwestern for medical school as well. In addition to a full-time practice here on the North Shore, I also work as the Regional Medical Officer for AMITA Health Medical Group, which means I'm a physician executive in charge of many of our doctors and clinics here in the Chicago region. Lastly, I'm a senior attending physician at AMITA St. Francis Hospital, just down the street from the Levy Center. I'd like to quickly go over today's outline so that all of you have a sense for what we're going to cover. And I think it's fair to say that we could talk for hours and hours about COVID-19 and the COVID-19 vaccines that are available now or will be available. But I like to focus on a few things. I like to start by talking about the current state of our pandemic, as well as the current state of vaccination efforts. Then we'll move on to discuss why the senior population is important with COVID vaccination. We'll discuss some current vaccine options as well as others that might be available in the near future. We'll cover the future state of what I see and what others see might happen in the next several weeks and few months from a COVID vaccine vantage point. I like to throw out a few myths regarding COVID-19 and vaccines for a section that I call Mythbusters. And then we'll go over some live Q&A with the help of Sam. Many of you, thank you very much for submitting questions beforehand. A lot of incredible, insightful questions that we'll talk about later today. So I like to get started with what I call a reflection. Just something to frame the discussion today. And I'm not sure if you can see something on your screen. I have a little thing on top here, but let me read that for you. It says, we have to reinvent the wheel once in a while, not because we need a lot of wheels, but because we need a lot of inventors, as quoted by Bruce Joyce. Bruce Joyce, for those of you who don't know, is a fairly well-known researcher in education, both secondary and primary care education, was a faculty member at the University of Chicago for many, many years, and now is out east. But I thought it's a great little quote to frame what we'll discuss today. So let's start out by discussing the current state of our pandemic and the current state of vaccination efforts here in the United States and elsewhere. First of all, I'd like to define what COVID-19 is, because there are some confusing terms and a lot of acronyms that are thrown about. COVID-19 is the same thing as SARS-CoV-2. SARS-CoV-2 is a shorthand or acronym for Severe Acute Respiratory Syndrome Coronavirus 2. This is the name that the World Health Organization gave to that virus that you see on the left-hand side of your screen, perhaps one of the most famous images right now in the world, and will continue to be one of the most famous medical image that everyone knows throughout the world. The middle image you see out of the three images is a close-up representation of a cell, a human cell, and the cell is in blue there. Now the blue color and that greenish teal type color are enhanced colors so that you and I can see what's happening. But those little greenish dots or blobs are the COVID-19 virus on top of a cell and infecting a human cell. On the right-hand side is a third representation, kind of a similar to the middle view, but this is a electromicrograph photo of a human cell with all those little dark, grayish black round things along the surface. Those grayish black round blobs or circles are the COVID-19 virus, SARS-CoV-2. So you see three representations of what we are dealing with in the United States, in Chicagoland, and throughout the world right now. Now, what does the current state of the pandemic look like in the world and in Illinois and in Chicagoland? So as of yesterday, the World Health Organization reported over 110 million cases of COVID-19 and almost 2.5 million deaths. directly attributed to COVID. Just in here in our state of Illinois, we've had almost 1.2 million cases as of yesterday, and just north of 20,000 deaths. If we look at vaccination rates here in Illinois, we have 2.7 million available doses. We've administered 2.2 million doses here in Illinois, and the 7-day rolling average of daily vaccine administration is almost 53,000. The idea of looking at a 7-day rolling average gives healthcare administrators, public health officials, myself as a practicing physician, as well as those in the public, a sense for how aggressive we've been and how many people are getting vaccinated at any one time. Another way to look at these numbers is to look at the percentage of supply used. And almost 80% of our current supply in Illinois has been used and administered and gotten into the arms of Illinoisans. Another way to look at the current vaccination rates here in Illinois is to look at how many days it would take to use up our current supply if we weren't getting any more vaccine and we just used up what we had. It would take about 10 days, 10 days. Now, the CDC is our primary source for guidance and helping us identify what to do, when to do, and why to do things with respect to vaccination programs. And the CDC has a 4-pronged plan to administer COVID-19 vaccines throughout the United States. First of all, the CDC emphasizes that we have to make sure that the vaccine efforts are safe and effective. Secondly, we want to reduce transmission, morbidity, and mortality from the COVID-19 disease. The third aspect and the third goal for any vaccination program in the United States is to also help minimize disruption to society. So to our economy, to our businesses, as well as maintaining healthcare capacity. When you hear about healthcare capacity, most people think of that as our hospitals, and are the hospitals overwhelmed or not with COVID-19, and how soon can we go back to everyday quote unquote normal efforts with healthcare. The fourth aspect of COVID-19 vaccination programs is to ensure equity in vaccine allocation and distribution. Now, a quick aside for all of you who are following along with the slide deck, I try to include sources of my information at every opportunity, and you'll see those. It's kind of small, but you can certainly see it down in the bottom right-hand side. So for example, these 4-pronged goals are taken directly from the CDC's website. So here's a breakdown of how we're approaching things in Illinois. So as many of you know, every state has been charged with running vaccination efforts within their states. And there's no organized national program for vaccinations. Here in Illinois, we are a little bit different than most states though, where we have 2 jurisdictions in charge of COVID vaccine allocations. That's the Illinois Department of Public Health and the City of Chicago's Department of Public Health. Because the City of Chicago is so large, their public health department reports directly to the CDC. Anything outside of that 606 zip code will will be managed by the Illinois Department of Public Health. Okay, the City of Chicago and the state of Illinois are working very closely and pretty much have mirrored their efforts. But here's a breakdown you'll see in the chart in front of you. When you hear about these phases, everyone hears about phase 1A, phase 1B. Where am I in this? It's kind of complicated, and it runs into the theory that certain populations are going to be at higher risk for developing COVID-19, higher risk of being exposed, or higher risk of developing complications from infection, okay? So in that first column, you'll see the different phases. Phase 1A, was divided up to healthcare personnel, a little over 500,000 folks here in Illinois, okay? And these numbers include the city of Chicago, by the way. And then the long-term care facilities, both the residents and then the staff who work there, and that's around 340,000. We're currently finishing up phase 1A in Illinois, and we've entered phase 1B a few weeks ago. Now, phase 1B is broken into 3 different parts. Part 1, which includes frontline essential workers and first responders, and then another aspect of that part 1 for phase 1B of people 65 and older. Part 2 of phase 1B will include those people who are considered high risk and younger than 65, so 16 to 64, but have high risk comorbidities. So that means folks who are, let's say, in their 50s and also have chronic heart disease or hypertension, have diabetes or kidney disease, or are immunocompromised due to medications like steroids or other types of medicines. Phase 1C will include other essential workers, and we're not there yet. And then lastly, there's phase 2. Phase 2 is really not well defined yet, but generally speaking, will probably apply to everyone outside of the phase 1 groups. This chart, by the way, and this description is taken from the Illinois Department of Public Health's vaccination plan, version 6, which was last published on the 10th of this month. The Illinois Department of Public Health, or IDPH, continues to update these versions every 2 or 3 weeks. So probably version 7 will be out in the next few days. So a big question that I get all the time is, Dr. Max, why can't we get these shots in people's arms? Well, there are a lot of reasons, and we can have discussions and go back and forth for a long time and still not get a final answer here. But suffice it to say, Mother Nature plays a role here. In front of you, you see the title to an article from the Washington Post last week. Winter storms delay distribution of 6 million coronavirus doses. There are certainly many manufacturing delays, and this cuts across supply chain issues, reagents that are used to develop the vaccine, reagents in the final manufacturing and distribution process, things that you might not think about, like having enough needles to give the shot, as well as freezers or storage capabilities. Unfortunately, there have been many inefficiencies from an operational standpoint. This is something that I would call uncharted territory for everyone in the world. Uncharted territory because we have never had to deal with something like this ever in the history of humankind. There's something called the curse of technology, this two-edged sword, that we're using technology to speed up distribution processes. We've used technology to speed up the development and manufacturing of the vaccine. But at the same time, those who need the vaccine the most might not have access to all the technology that's needed to sign up and register for vaccines. Lastly, the COVID precautions that all of us follow every single day pose a challenge for us. Gone are the days where we can pack a bunch of people like sardines into a room and have vaccination clinics like everyone used to do for influenza. We have to be mindful of social distancing. We have to stagger the opportunities to receive a COVID shot. So these are just some of many challenges that we have currently here in Chicagoland to get COVID vaccines distributed. Now, the rollout has been slow for COVID vaccination efforts. And in front of you, I have a bar graph from the Wall Street Journal. And the reference is down there on the right-hand side. January 31st article by Hinshaw and Cherney, looking at several countries and using the variable of how many vaccines are administered per 100 people in the population. You'll see a number of countries, and you'll see the United States with the little arrow next to our name. And those countries in the dark blue are those who hopefully will vaccinate 1/3 of their population by the end of 2021. Israel is doing the best right now of 2.1 people per 100 getting COVID vaccines. And you see the other countries there. Not many countries that you would think are at the top of the heap, okay? And it's interesting that some of you might remember, and I remember this though, that the EU, the European Union last year, made this bold statement saying that we will vaccinate 70% of our population by the summer of 2021. I don't see a lot of European countries on that top 10 list. And those that are on there are not going to be able to vaccinate, 70% of their population by summertime. Part of the challenge is everything that we talked about in the previous slide of manufacturing delays, organizational snafus, and such that are delaying our opportunity to vaccinate folks. And this varies from week to week and country to country. Now, here's another slide taken from the same article. This bar graph looks at data that were analyzed by Goldman Sachs and looked at getting to herd immunity at some point in 2021. Herd immunity is the concept, it's a public health concept that when a certain number of people within a population segment are vaccinated, typically the benchmark is 70 to 80%. Once that threshold is reached, a disease is unlikely to spread within that population, okay? Israel is the only country that's predicted in a reasonable manner to reach 70% of their population by the end of 2021. That leaves a lot of countries out there who are still struggling for this herd immunity. Now, if you look at that graph and you go down the list and you see South Korea, you see Hungary, you see Malaysia, I don't see the United States on there. The United States is not on the list, okay? Now, to make matters just more challenging, herd immunity might not be achieved because of these new mutations that we're seeing in the virus, reductions, which could result in reductions in vaccine efficacy, not to mention a lot of unforeseen logistical delays to achieve these efforts. So let's move on to our second topic today in our outline, and that's looking at the concept of targeting certain populations before others, okay? Now, why should we prioritize seniors? We shouldn't prioritize them just because we're with the Levy Center today. Now, certainly that's important, but from a medical standpoint and science standpoint, age is a huge risk factor for disease complications. So I have here in front of you a line graph that's from the federal government, okay, the AHRQ, that looks at morbidity, mortality, and specifically hospitalization rates based upon age. The top line, okay, and this goes from the year 2000 to 2015, the top line looks at hospitalization rates for the 65 and older population. Now, values have improved over the past 15 years here with a 25% decrease in hospitalization rates for the senior population. But clearly the senior population has the highest risk, okay, for hospitalization. It's almost 3 times as high as the grouping, the age grouping just below it, which is the 45 to 64-year-old population. And it goes without saying that the vast majority of health dollars are spent on hospital stays and on that 65 and older population. So now if we look at COVID-19 specifically, and we look at hospitalization rates and death rates based upon age, here's another graph from data published by the CDC in the United States, okay? And this is a busy slide, and it's kind of a little bit hard to understand, but let me walk you through it. In yellow, okay, going across, you see different age groups. The 5 to 17 year age group is considered the reference group, okay? So the null group. And then as you go from left to right, you see different age groups all the way up to the 85 plus year age group, okay? All the way on the left, you see the column that gives you cases, number of cases, number of hospitalizations, and number of deaths. And then you go across in the squares and you look at the likelihood compared to the reference group. So for example, and I like to use the 18 to 29-year-old group because that's really the first group that we think of, especially as an internal medicine doc, but we think of those who are at higher risk for hospitalization and death. So compared to the 18 to 29-year-old groups, the rate of hospitalization for the 75 to 84 group, and so I'm using my cursor here that you can see, right over here, okay? So this column, okay? The hospitalization rate right here, it says 15.5 times. That's 8 times higher than the 18 to 29 group. So the way you derive that value is you take 55 and divide it by 7, and you get about 8 times, okay? Now, if we look at the death rate for that 75-year-old group, though, it's almost 190 times higher, so almost 200 times higher than the 18-year-old group, okay? Now, if we look in another age range, we look at the 50 to 64-year-old group, okay? So those who start purchasing AARP and become members for AARP, once you turn 50. Those folks, compared to the 85 plus year old group over here in terms of hospitalization, is 3 times higher. But the death rate is for 85-year-olds is 20 times higher than the 50-year-old group. Those numbers are humbling and are staggering. And that's another reason why I should say, why we're targeting the senior population. And that's why all of you are here today, because you're concerned about that senior population. Here's another look at numbers, and this is this bar graph is looking at similar information, okay, but by age group, okay, and then looking just at death rates, okay. So you see this broken down from the bottom with 0 to 4 age, all the way up to 50 to 64, 65 to 74, and then 85 plus. And you see the bar graph going all the way across, okay, of the death rates here per 100,000 people within an age group. So everyone gets this theme that I'm making the case for the senior population is a high risk population, irrespective of other health issues. Even if you're a super healthy 95-year-old patient, like I saw this morning, okay, just by virtue of your age, you're at higher risk for dying from COVID. So if we look at the different causes for death in the United States, okay, and we look at just the top 4 causes here in the United States, and this is tracked annually, okay, this graph or this chart is from data taken from the Journal of the American Medical Association, or JAMA, okay, at the end of last year, okay. This year, the top 4 causes of death, okay, for all ages in the United States are ranked, and I have that on the left-hand side. Number 4 is emphysema or COPD, so chronic lung disease. Number 3 is COVID-19. Number 2 is cancer. Number 1 is heart disease, okay? Now, it goes without saying that COVID-19 was not on the top 10 list or the top 4 list in 2019 or any time before that, okay? So think about all those books, that we read, and we hear about books ending up on the New York Times bestseller list all of a sudden. I love reading, and I love libraries like many of you do. COVID-19 made a jump, okay, in a short few months, all the way up to number 3 for all ages. But now if we break this down further and we look at age groups, you'll see that red arrow over here on the right-hand side of the screen for the 85 plus population. COVID-19 made it to number 2, just behind heart disease, okay? That's staggering, and that's really, really scary. Now, if you read this article in JAMA, the discussion section of the article mentions that the COVID death rates were probably a lot higher than what was reported due to several factors: delayed reporting, underreporting, and misreporting due to other medical diagnoses and such. So these numbers actually could be higher. So what about safety in the frail elderly? Some have made the argument about COVID-19 vaccines and said that we should not vaccinate older folks or seniors because vaccines just are too dangerous for those people. Well, in front of you, I have 3 real world examples of safety in elderly in that very vulnerable population, okay? The first is an article published by ACIP. That's the Advisory Committee on Immunization Practices. It's a branch of the CDC that makes the recommendations nationally of what vaccines should be given for what reasons, okay? They helped sponsor, along with the NIH and Brown University's School of Public Health, a study that looked at skilled nursing facilities, so rehab facilities, and studied 25,000 residents who received the COVID vaccine over the course of a couple months. They found no increase in mortality rates for those patients who had the COVID-19 vaccine. The World Health Organization has a safety subcommittee for COVID-19 that also issued a statement last month, and they found independently that no increase in mortality or adverse events were found in long-term care residents, okay, throughout the world after receiving the COVID-19 vaccine. A third real-world example was published by MMWR. MMWR is the Morbidity, Immortality Weekly Report. It's a journal that's published by the CDC, okay, and comes out weekly. Last week's MMWR also released data suggesting no increased mortality, so meaning no increase in death rates in American long-term care facilities as a result of COVID-19 vaccines. So you can see here 3 real-world examples suggesting that the vaccine is very safe, and so age should not be a reason not to vaccinate. Now let's look at some of the COVID-19 options that are available right now here in the US, as well as a few that might be available in the near future, maybe in the next weeks or months. Now, I like to say that the development of this COVID-19 is truly a modern miracle of medicine, a modern miracle of medicine. I have a little image of a book, or at least an author that many of you are familiar with, Isaac Asimov. I read his books and watched movies, based upon his books as a child, and still as an adult, I read them again and again. I think they're incredible. The COVID-19 vaccine and the efforts to develop a vaccine is nothing less than science fiction come to real life, okay? The traditional journey for a pharmaceutical, especially a vaccine, to come to market, okay, usually lasts anywhere from 10 to 15 years. And the development phases, and then the final phases in which the vaccine gets approved for government by the government for use, and then gets distributed throughout the United States or throughout the world, 10 to 15 years. Just in a matter of a few short months, we in the whole world, and we in the United States especially, had a vaccine available for us. That's incredible. And that's science fiction. That's a fantastic voyage. Not only that, but the concept of identifying the virus and identifying its genome, so its genetic makeup. And by doing that, we were able to really get our hands around what we're dealing with and how to conquer COVID-19. Breaking that genetic code, breaking that genetic code took weeks instead of years, like it has in other types of pathogens. Researchers dared to combine old theories of vaccination and old theories about pathogens with modern technology as well, and invented new methods to develop a vaccine, new scientific studies, study algorithms that have made vaccine development better, stronger, and faster. It's really, really a modern miracle, okay? This is truly the first time that we've had a global effort that's been singularly focused to conquer a healthcare crisis. So let's talk about some vaccine options. And so I have two slides here. This is the first of two, looking at vaccine options, okay? The two that we have available here in the United States right now are the Pfizer BioNTech and Moderna vaccines, okay? Both demonstrate really, really strong efficacy. So you're looking at 94% efficacy. Both are given in 2 separate doses. The Pfizer at 21 days apart, the Moderna 28 days apart, okay? With a very similar side effect profile, okay? Pain, swelling, or redness at the injection sites, maybe some headache, maybe some muscle or joint pains, low-grade fevers, things of that sort. 2 other vaccines that might be coming to market soon here in the United States are the 3rd and 4th vaccines that I have there on the screen. The Astrazeneca / Oxford University vaccine was developed in the UK primarily, and it's the main vaccine used in the United Kingdom right now, and demonstrates a 70 to 90% efficacy rate, depending upon the study, and is also a 2-week vaccine. Typically, it's given 3 or 4 weeks apart, but the UK has stretched things to up to 12 weeks apart between the first and second dose for various reasons. You'll see the side effect profile very similar to the Moderna and Pfizer vaccines. One caveat here is that all of the AstraZeneca data have not been published, or I couldn't find them, available online. So some of these side effects might be a little bit different for that AstraZeneca vaccine. The 4th vaccine that might come to market here is the Johnson & Johnson vaccine that demonstrates anywhere from a 66% to a mid-80s efficacy rate. So a little bit lower than the other vaccines. It is designed differently than the Pfizer and Moderna vaccines. But the cool thing is that the Johnson & Johnson vaccine is just a 1-dose vaccine. Side effect wise, it's similar in terms of a flu-like illness or fatigue and muscle aches. Again, like the AstraZeneca vaccine, all the data have not been published on that. So it's hard for me to say with certainty what all the side effects will be or can be with the J&J vaccine. Now here's 3 more vaccines that are in development worldwide. I'm not sure if these will come to market here in the States or not, but I want all of you to be aware of them because you might have friends or family overseas, or you might be interested in these. And again, maybe they'll come to the United States. The Sputnik V or Sputnik 5 vaccine boosts a almost 92% efficacy rate, and it's also 2 doses, 28 days apart. Similar side effects as the others. The Cyanobio vaccine has been developed in China, and it's used right now in Mexico and also used in Russia, as well as a few other countries. I think India is one of those as well. It's purchased millions of these vaccines and is using them. It's a single dose shot. Efficacy rate in the mid 60s to 75% or so. And then the Barret Biotech vaccine has been developed in India, and is currently being used in India and I think a few Central American countries and a few Asian countries. It's a 2-dose vaccine that's around 60 to 70% effective. Again, similar side effects. I think it's important to note some of these side effects here because you see a common theme that all these vaccines have similar side effects. And many people will say to me here in the office and elsewhere, say, Dr. John, you know what? I heard about all these side effects and I don't want to get a vaccine if I'm going to have side effects. That sounds awful. Well, my response is this actually. It's good that you get some side effects, like these flu-like illnesses and this achiness or a sore arm, because what that says to me is that your body is responding to the vaccine. You're mounting an immune response. That's actually a really, really good thing. So I'm really happy about that. Okay. So let's look at some safety concerns about COVID vaccines. Many of the questions submitted prior to today's talk actually had to do with safety concerns. There's lots and lots of discussion right now in medical communities as we develop more experience with these vaccines, what I like to call real world experience, but also experiences in many study protocols that are ongoing, not only for the Pfizer and Moderna vaccines that are FDA approved here in the States, but all the other vaccines have ongoing studies throughout the world to identify more issues, whether they're good or bad, and we get ongoing information. It's fair to say, I think, that the mRNA vaccines, that's the Pfizer and Moderna vaccines, those are the only two that are mRNA vaccines, seem to have more side effects to the traditional vaccines. One explanation for those side effects are what I mentioned earlier, that when you have that achiness and that low-grade fever, maybe that nausea or that stomach upset, that's your body responding to it. We found that these mRNA vaccines really boost the immune system, and it's one of the explanations why those efficacy numbers are so high, in the mid-90s and better than any other vaccines. There are episodes of severe reactions to all of these vaccines, but those numbers are actually pretty rare. So something like anaphylaxis is considered a severe reaction. Anaphylaxis is that severe life-threatening reaction when someone gets exposed to an item like a vaccine and then starts developing shortness of breath, starts having a rapid heart rate, the blood pressure starts falling, and that person could potentially go into shock. Statistically, the numbers are for the two vaccines pretty low, and the number, I'm talking about the two vaccines here available in the States, the mRNA vaccines, about 4.5 to 6 events per million doses. So if you compare that to, let's say, the influenza shot, and many people consider the influenza shot a very, very safe vaccine, we can go to our local CVS's and our local pharmacies to get those vaccines. We certainly get those in the doctor's offices. We get those at our work environments, or used to at least before COVID. Statistically, those numbers are around 2.5 episodes per million. So you say 2.5 versus 4 or 4.5 for the mRNA vaccines. Statistically, that's not significant. So statistically, those are considered compatible and similar, okay? Another safety concern or ethical concern for COVID vaccines is this idea that fetal tissue has been used in the manufacturing process. That is not true. Fetal tissue has never been used in any manufacturing process and will never be used in any manufacturing processes for COVID-19 vaccines, okay? Now, another safety concern for many is the idea that we just haven't had enough experience with these vaccines. And so using post-marketing studies will give us better insights into how safe these are. And things might change, okay? And our understanding will definitely mature over time as vaccines, are used more and as the virus evolves. But I think right now, as of February of 2021, these vaccines seem to be quite safe. So I want to go into further depth about side effects because I think this is an important sticking point for many folks. And I want all of you here with me today to feel comfortable if you choose to get the COVID vaccine or if you've already had 1 or 2 shots. Because I work in healthcare, I was blessed to have the opportunity to receive a COVID vaccine, and I've completed my 2 shots, and I felt fine with them. Okay. But let's look at the 2 mRNA vaccines, the Pfizer and Moderna, vaccines, and see what the numbers look like. The side effects in the real world, meaning after it was released to the general public, suggest more side effects than the research trials. Okay. The second shot seems to have more side effects than the first shot. Okay. And as I mentioned earlier, that second stronger immune response to the second shot, which is what the second shot's supposed to do, is supposed to boost your immune system to give you enhanced long-standing immunity, is consistent with those high efficacy rates for these 2 vaccines. So if you look at the graphic on the right-hand side of the screen, you see 2 different colors. You see in blue the first dose, and in, I guess I'd call it orange, for the second dose. And it goes by different side effects. So the most common side effect is injection site pain. So just having a sore arm afterwards. First dose, 68%. Second dose, all the way up to 75%. And you'll see a similar theme with fatigue, headaches, muscle pain. That's just, that achiness, all the way up to 42% for that second dose, and so on and so forth. So, those side effects are not significant. Okay. Now, here's a couple of more important points about this. The Astrazeneca vaccine, used primarily in the United Kingdom, suggested that there's a 42% fewer side effect rate compared to the Pfizer vaccine that they've used over there. Now, this past Friday, so last week on the 19th, another report came out from the MMWR that looked at real world side effects, 2 Pfizer shots and only 1 out of 2 Moderna shots. And I'm not sure why just 1 shot was reported from Moderna as opposed to 2. I think it had to do with timing of the data getting published, because this is kind of a follow-up to another MMWR vaccine side effect study published last month. So in March, we'll probably have another follow-up report. But this report from last week boasted 91% of people had some sort of side effect, whether it was injection site pain or fatigue or chills, but almost everyone did. So the bottom line for all of you, if you're going to get a vaccine or you had a shot already, plan on having some sort of side effect. Now, before we look at future states or our next topic for today, I do want to mention that the side effect duration for the COVID-19s has been very, very short-lived. So the vast majority of folks who received a vaccine had side effects in the first 1 to 3 days. I didn't show numbers from a couple studies that looked at the first 7 days after a vaccine. And the numbers for these side effects were very high in the first 1 to 2 days and then quickly tapered after that. Okay. So I was fortunate that my second COVID shot was on a Friday morning, and I started feeling tired that night. I had a full day in the office here in my clinic. I got through the day fine, but I was really, really wiped out by the end of the day, as if I hadn't slept for 2 or 3 days. All I did is I ate dinner with my wife and my kids. I went to bed early, and by 5:30 a.m. Saturday morning, I felt totally normal. I felt well rested. So that's an anecdote, but an example for me that I want to share with all of you from a vaccine standpoint. But let's move forward and talk about the future state, okay? Vaccine recommendations are a work in progress. They will continue to be updated and revised as we, the medical community, receive more data and more experiencing with respect to dosing schedules and such. So here's an example of that. I'm going to give two examples. So last week, Astrazeneca announced a higher efficacy rate for their vaccine, 89%, okay, for several weeks after the first dose. Now remember, the Astrazeneca vaccine is a two-part vaccine, giving anywhere from 3 weeks to 12 weeks apart, okay? And so this study suggested, or the authors suggested, that the second shot can be delayed for up to 12 weeks. Now this study was published in Lancet, so you have the reference down below on the right hand side. Lancet is the oldest active medical journal in the world, and it's a big international journal. It's based in the UK though, okay? A lot of researchers and public health experts disagree with this conclusion that you can wait for that second shot for a while, okay? Because it's really in conflict with all the other studies published on the AstraZeneca vaccine, okay? And what all the other studies showed is that if you wait for up to 12 weeks for that second shot, the benefits aren't there, and the immune system needs a second shot to really enhance and prolong the benefits, okay? Many people also argue that this analysis was not scientifically rigorous. The study was done post hoc, meaning that the studies were not planning to look at this delay, and so the researchers went back and just looked at it. That type of analysis from a medical and scientific standpoint doesn't hold a lot of weight. It's not as reliable, and so we don't put as much faith into that type of study, okay? And the UK Health Ministry, is using this report from AstraZeneca as a vindication for their efforts to delay vaccine efforts, okay? So again, many experts disagree with this approach. Here's a second example, hot off the presses. You'll see the reference down below on the right-hand side. This comes from the New England Journal of Medicine, another one of the premier medical journals throughout the world, published here in the States, so New England, okay? And one of the oldest medical journals around today. Pfizer published a report that concluded 92% efficacy 2 weeks after the first shot, okay? And so they're making the case that you can delay the second shot for more than 3 weeks, okay? And you can wait a little bit longer. Right now, and oh, by the way, that's an actual picture of a Pfizer Biotech COVID-19 vial. You can see that in a freezer in the cold, ultra cold storage, okay? What's interesting here is that, and you see this on the third bullet point, is that Pfizer found a surge in the benefit after the first dose, not right away, okay? Not after the first week, but after 2 weeks, that the numbers went up significantly from 40% range all the way up to 92%. Even though on the whole, after 3 weeks, the overall efficacy was only noted to be 53%, okay? So that makes the case that we still need that second shot to be beneficial, and to really get your most bang for your buck, you need to get 2 COVID vaccines if that's what's necessary, and you need to get them in the right timeline. Another important aspect to vaccine recommendations getting changed is that Pfizer also applied to the FDA to allow their storage of their vaccine to remain in the typical pharmaceutical storage fridges from -13 to 5 degrees Fahrenheit, instead of those ultra cold storage freezers that we've all heard about that keeps things at -70% Fahrenheit. If the FDA allows this change in this update, this would be huge for all of us, because this would help increase our opportunities to get vaccine out there in the communities, to store it, and also give us more flexibility to administer the vaccine and get those shots into our arms. This is really, really big. To me, this is one of the game changers. And that's hot off the presses for all of us. So other future state ideas with respect to vaccine recommendations being revised again and again and again. And these, here's something that we just don't know the answer for, really. What will be the outcomes if we do delay a second COVID shot? Okay, maybe that series of 2 shots will still be just as effective, but we don't know yet. We're waiting to find out. These studies are ongoing. Will that delay help improve our allocation and distribution efforts? That's what the UK is doing right now, okay? But will this delay be an opportunity for vaccine-resistant strains to grow, much like what happens with bacteria and antibiotics, okay? History definitely tells us that nothing will stay the same and things are destined to change. But all the technology we have will accelerate the progress faster than ever before. And I've got to mention this as well, that this is terribly confusing to many people, myself included. I think the experts, I'm not saying I'm an expert, but I work in healthcare and I'm a physician that deals with this every day. The experts are confused by this. So don't feel bad if your head's spinning and say, well, I heard this, but then my cousin said that and my grandson told me this. It's important to make sure you lend your ears to the right social media, okay? Social media that's based on science and what we call in the business, we call evidence-based medicine. We need to use science and research to guide how we approach things, okay? And when you talk to folks about COVID vaccines, please make sure you use trusted advisors, okay, who can help you sort through vaccine information and offer you the real deal, not something that popped up on Facebook or something that you saw, on some sort of program or whatnot. Discussion is great and conversation is great, but when it comes to the end of the day and what you're doing for your health to age successfully, I want you to rely upon science and trusted advisors. So when are things going to return to normal, Dr. Max? That's another question I get a lot. Unfortunately, my crystal ball is cloudy when it comes to that question, okay? I do think, though, and many experts think, that herd immunity is going to be a cornerstone of success in getting back to that normal state of things. And the only way we're going to get there is through high vaccination rates. We do need more efficient vaccination models for every age, not only for seniors, but for those who are below the age of 65, for those with chronic health issues, but also kids. Right now, the COVID-19 vaccines are only approved for people 16 and older, okay? But there are ongoing studies, so phase 3 studies, to look at the below 16 age groups. It's also important to note that full immunity from these vaccines takes really 2 to 3 weeks after that second shot, so after you complete the series, before you'll really have that Teflon vest and you'll be truly vaccinated against COVID-19. Now, the COVID precautions will continue to evolve, and we all know about those things. We know about the masks. We all know about eye protection and social distancing. We all know about the hand washing, the hand sanitizers. Those things will be part of our new normal, okay? Whether you like it or not, it's something to accept. And it is important to wait for a vaccine. As long as you continue maintaining those COVID precautions, which I think are essential, it's okay to wait a little time. I know that there's a lot of stress for everyone, and if it's not for you, it's for your friends or family members. When am I going to get a vaccine? I haven't been able to get a vaccine yet. And I hear everyone else in the world has one except for me. It's okay to wait. As long as you're maintaining those COVID precautions, okay, we will get to some sort of normalcy in the future, okay? But we all have to stay strong. So here's a number of questions that I have, and maybe you have these too, that I need these questions answered. Physicians, healthcare professionals, the communities, the public needs these questions answered, needs good answers before our lives can return to normal, Okay. Number one, what's the long-term efficacy for these COVID vaccines, and will continue to be safe, in the long term? We're studying that right now. There's a chance that we will need booster shots at some point in the future, similar to what we do with influenza vaccines, where we have seasonal flu shots every fall and winter, and that the makeup of the flu vaccine varies from year to year based upon predictions of the predominant viruses that will circulate during that season. We don't know what the timeline will be. We don't know how, that'll come about, but that's something that we'll have to think about and act on if it's the case. When can we spend time with our family and friends without fear of getting COVID-19 from my brother, my sister, my niece, my nephew, my kids, my grandkids, my great-grandkids? I don't know. But that's something that we all have to look into and figure out. When can we travel, both domestically and internationally, in a safe way? The guidelines from the CDC continue to change for international travel as well as local travel. Many of you remember these travel restrictions or these maps of the continental US, and looking at good states and bad states. And if you come from a bad state, you have to quarantine for 14 days, or you have to do this or do that. Hopefully that type of process will quiet down and will improve as we develop herd immunity and have more people vaccinated here in the US. And of course, when can we play ball again? I have that nice photo from one of the greatest times in Chicago history, with the Chicago Cubs winning a pennant. When can we play ball again? I hope sooner than later. I hope to be one of those people with a Cubs hat on in the near the deck, and watching the Cubs win another pennant. I can't wait for that. So what can I do right now, though? What can all of you do to secure COVID immunity? I'm sure many of you are wondering this, and after we've talked about the different vaccines and everything else going on right now here in Chicagoland, I want to throw a few ideas out to each of you of things that you can do right now to move forward with vaccination efforts. The first thing you can do is maintain consistent communication with your local public health authorities. So those are people like the City of Evanston's Department of Health. The City of Evanston, the Village of Skokie, the City of Oak Park are blessed to have phenomenal public health offices. We also have the Cook County Department of Public Health and the City of Chicago Department of Public Health, as well as IDPH, Illinois Department of Public Health, who are wonderful resources to learn about COVID immunity and vaccinations. And then, of course, you have other trusted organizations like the Levy Center, okay, and the Evanston Public Library, who are other organizations that are great and trusted. Being patient is going to be important too. There are going to be operational snafus. Maybe some of you with me today, or at least you probably know someone who was scheduled for a COVID vaccine only to get an email or phone call or text message the night before or the morning of the shot to say, you're canceled, sorry, don't come over, we don't have a vaccine for you. Those things have happened. I want to encourage all of you to be in touch with your primary care doc, okay? So whether it's in person or virtually, so the so-called virtual visits, who can give you some personalized advice based upon your health issues and your preferences, and have what's called shared decision-making for the COVID vaccine. This idea of leveraging technology to get COVID shots will continue. whether it's online or some sort of smartphone-based registration processes. So I want to encourage all of you to enlist the help of friends or family or volunteers to move forward with getting a registration process going for COVID-19 vaccines. Now, it's important to understand that the current immunization practices here in Illinois are very tightly controlled by the state, by Cook County, as well as local municipalities. Now, I do understand that there are a few of you on the call here who are not local, but in other states, and same thing goes for you. So whether you're a Chicago resident who's currently in Arizona or Florida, or that's somewhere where you live and you heard about this wonderful discussion, every state is like this, where things are tightly controlled. Okay, and so you want to be careful about someone approaching you and promising some sort of special deal for the COVID vaccines, or something that sounds too good to be true. Those scams are out there, and they're only becoming more numerous as we move forward with COVID vaccinations. Lastly, it's really important that if you are getting a two-part vaccine, so like the Moderna or Pfizer vaccine, you get that second vaccine planned as soon as you get the first one. There are some true sad incidents where people receive the first vaccine here in Chicagoland and receive no information on the second shot and can't find out how to get that second shot because they had some sort of special deal, or they heard from a friend of a friend and they got something. You got to get that second vaccine booked and organized right away. So let's move on to some what I call Mythbusters about the COVID-19 vaccine, and some ideas that are out there in the community or online or in other areas and other conversations. Myth number one: only certain ages can get COVID. I'm a healthy college student. Why should I bother getting a COVID vaccine? Because I can't get it, and my friends who had it feel fine. Okay, well, that's not true. People of all ages can be infected with COVID. COVID does not discriminate against age or gender or cultural or racial background or zip code. COVID-19 affects everyone. And some people are asymptomatic though, and some people are pre-symptomatic, meaning they don't have many symptoms for several days and are shedding the virus and infecting others until they do develop COVID symptoms. It is true that younger people tend to have milder symptoms, okay? And it is true that if you have COVID-19, you can spread the virus even if you have very few or no symptoms at all. So that's why it's important that we maintain COVID precautions to prevent illness in every age group, okay? And that's why the concept of vaccinating all persons, okay, will dramatically reduce infection rates for all of us. Myth number two: the doctor's office is a COVID kingdom. Why would I go to the doctor's office or the hospital? I'm going to get COVID there. That's where COVID people are. Actually, the opposite's true. Healthcare destinations are super safe. Healthcare destinations like the doctor's office or the hospital are probably the safest locations outside of your own home. Okay, keep in mind that hospitals and clinics are at the leading edge of COVID protection. They've dealt with infections and safe workflows forever. Okay, they're part of these reemergence campaigns to keep patients safe and their staff safe. They have rigorous hygiene and disinfecting efforts, and they follow best practices, meaning that those are areas where you're definitely not likely to get infected with COVID-19. And there's constant collaboration behind the scenes between healthcare systems and public health authorities. That's where the recommendations come from. Okay, so healthcare destinations are really safe. Now, here's our third myth. Our third myth is that I don't know if you can see it. I can't see on my screen because of that top thing here, but I'll read it for you. I can skip health maintenance and skip, my routine health stuff, like having physicals or getting my mammogram, until everyone's vaccinated. I'm just going to hold off on those things. More than ever before, those routine health measures are going to be one of your keys to aging successfully. And those routine health measures are things like the annual physical, focusing on wellness and prevention and screenings, routine vaccinations for kids, for your grandchildren and great-grandchildren, and adult vaccines cannot be postponed. Last year, there were many case reports published on outbreaks of preventable illnesses, such as measles and whooping cough, because vaccines weren't being delayed in kids. Another aspect that is pregnancy care. Early on in the vaccine pandemic, there were news reports of pregnant women or pregnant couples having complications with the pregnancies because of COVID-19. What actually happened when things were looked at in greater detail was that those women who were pregnant were not getting their routine prenatal antenatal care, and so that's where complications occurred. But now we found that as couples do go through the routine pregnancy practices, pregnancy's been fine, baby's been fine, healthy babies. Another routine health measure that's been really important is the influenza vaccines. This year, influenza rates are dramatically lower than previous years, in large part because of our COVID-19 mitigation efforts, okay? Because those are the things like hand washing and masks. Those are the things that help prevent the spread of influenza. But part of the success also came across because more people are getting vaccinated for influenza. So I'd encourage all of you to do that. It's not too late. We're still in the middle of influenza season, all the way up until mid-March in April, and to the end of April, in fact. There are some studies that looked at hospitalized patients with COVID-19 last year and found that those patients who were hospitalized and had the flu shot for that season were more likely to walk out of the hospital and recovered faster compared to those who did not receive the flu shot last year. Okay, so what we think is that the influenza shots give some cross protection against other viruses, including COVID-19. Delays in routine preventive care and treatments can actually lead to worse outcomes. There's a body of literature in the oncology research, so cancer research, and in cardiology research, strongly suggesting that there are more heart attacks and more advanced cancers now because people have delayed treatments, have delayed screenings, have delayed doing the things that they've done in the past to keep themselves healthy. Okay. It's also important to note that for those who do get COVID-19, those who start healthier and are in better shape do better with the illness. And that's common sense, but science and research support that common sense thought. Okay. And of course, COVID vaccination is going to keep you safer. So I've covered a lot of things with all of you today. We still have some time to go for some questions and answers. I'd like to open it up, and my moderator today, Sam, will go through some of the questions that each of you has submitted earlier. So Sam, are you there?
I'm here.
Great, great.
We had a number of questions submitted, so I'm going to start with some of the bigger, more unique ones. For individuals that have other conditions or autoimmune diseases that they take medications for, like over-the-counter pain medication, is it safe for them to take it before or after vaccination if it's on their routine medication schedule?
That's a great question, Sam. And so I would say this. I'll have a two-part answer to this. Part number one to my answer will be that if you have a medicine, and medicines are prescription and over the counter, if you have something like that, it's taken on a regular basis, go ahead and continue those medicines. don't stop them when you're getting the COVID shot. The second part of my answer is the idea of taking something to help reduce those side effects. And I showed you that information from last week of 91% of people, according to the MMWR report, 91% of people getting the COVID shots here in the States have some sort of side effect. Okay, temporary but side effects. The CDC recommends against taking something before you're getting a shot. Simply because they don't want people taking a bunch of medicines without good reason to do that. But if you got your first shot and let's say you did okay and the second shot's going to have more side effects and you're dreading that type of thing, taking something like acetaminophen, Tylenol, Advil or Aleve, or taking something like Benadryl is okay. And will not reduce the benefits from the vaccine, but might make those 24 or 48 hours more palatable and more manageable.
Okay. Another question is, if I'm in the process of getting vaccines for other things like shingles or hepatitis, is it safe for me to get the COVID vaccine?
Great question. Right now, the recommendation is to try to avoid getting shots within 2 weeks before or after the COVID-19 vaccine until we have more data and more experience. Okay, so if we look, and again, earlier I talked about history will guide us with these things. If we look at the precedent from other types of vaccines, many vaccines can be taken together, okay, but some can't. For example, the flu shot and the pneumonia shot. There's 2 pneumonia vaccines available for adults, and many times doctors will give someone the flu shot and then one of the pneumonia shots at the same time because that person is in the office and you want to capture them and you want to get them vaccinated, and those vaccines will not interact and your body will respond to each vaccine appropriately. Okay. 20 years ago when I finished, my training and started practicing medicine, the recommendation was the opposite of not giving those 2 vaccines together. But we found with research that it's safe and effective. So let me put it this way, Sam. If you can hold off a vaccine like that hepatitis shot you mentioned by 2 weeks, great. But if it's something that you need, don't postpone the COVID vaccine. Don't postpone that needed vaccine just because of that 2-week time range. It's just that we don't know, but chances are it'll be okay to get another vaccine at the same time as the COVID shot.
Okay. Next question is, I had COVID. Do I need the vaccine? And does it matter if it was mild, moderate, or severe case?
This is something also being actively studied. Right now, we think that people are immune from COVID-19 for about 90 days. So let's say 3 months after being ill. And that comes from studies looking at people who've had COVID, like the questioner here. People with more severe cases tend to have a more robust immune response, meaning that they have a higher titer of antibodies in their systems and might have a longer immune benefits from that COVID-19 illness. But we don't know really how long that that immunity lasts. Early on in the COVID pandemic, last year before we had any vaccines available, we looked at other types of coronaviruses like SARS and MERS. Okay, so the first cousins or the siblings of COVID-19, and looked at the length of time someone had immunity from those after getting those infections. And we saw that in SARS and MERS, people were immune for a year or 2 afterwards. Okay, and then with COVID-19, we found that many people had immune systems that did not show any antibody response after 90 days or so. And that's where this 90-day window came in. And along those lines, and the second part to your question, I think, Sam, was do I need to get a vaccine if I've already had COVID? My answer would be yes, you would. Because we don't know how long that natural immunity lasts. The guideline right now is that if you have had COVID, so a documented case, not say, oh, I had all the symptoms, so I think I had COVID, but if you're sure you had it because you had a test, okay, you want to wait 90 days after the onset of your symptoms before you have the COVID vaccine.
Next, I had my first vaccine and I had a strong reaction. Will I have a strong reaction for the second one, or should I get the second shot?
I would say definitely get the second shot. And no doubt about that. And I would say that's actually great that you had a what we call a robust response to the first shot. That means that your immune system is really, really responding well, and it's meeting its expectations and your expectations. Chances are, if you had a lot of side effects the first one, you're going to have that and a lot more with the second vaccine. So that's a scenario in which you might want to take something like Tylenol or Advil or Aleve, right after you get the shot to reduce those side effects.
After full vaccination, can I still carry and spread COVID-19?
We don't fully know the answer to that. We don't know if some people who are vaccinated can still get infected, maybe without symptoms, and still spread it. We just don't know. We don't think so, but we think there's some possibility, but maybe not to the degree as you have in the past. So if we look at the influenza shots as an example, influenza shots in the best case scenario are only 50% effective against preventing influenza. What the influenza vaccines do, though, for us is that they reduce the severity of symptoms. They reduce the amount of virus that's replicating in your body, and they help you recover faster. Okay, but if you get the flu shot and then you get influenza, you can still spread influenza for a couple of days. Okay, but you're just not as infectious, and you recover faster. Okay, so but that question remains to be answered with confidence.
Okay. Is there actually any difference between the first shot and the second shot, or is it the same dose?
The shots are identical. What you get in the first vial is going to be the same as what you get in the second vial. Okay, so there's really no difference there. Many of you who have tried to register or successfully registered already notice that you always get that question: is this your first vaccine or your second shot? You got to tell us. That's more for the logistics and for the reporting methods. Every single organization that gives a COVID shot needs to report data to the state, and then it gets passed on to the federal government, to the CDC. Every single day a shot's administered, okay? And part of that data gathering is whether you received your first or second vaccine. That's how we're tracking things and how we know that people are getting the full series done and such.
Okay. Can I get a vaccine from Pfizer for the first one and then get it from Moderna for the second, or vice versa?
We don't know yet. A couple studies have just started. In fact, I read an article last week that one study just closed its enrollment, meaning that they fulfilled the number of people they want in the study, and they're looking at that match, and looking at Pfizer first, then Moderna, and then the opposite, Moderna first, and then Pfizer. We don't know, but we don't think it's going to be as effective. And the challenge here is that each vaccine stimulates the immune system in a little bit of a different way. And so the second shot is meant to enhance and prolong that immunity process. And if you don't get that booster, that second shot, you're not going to get that enhanced immunity. Okay. Another way to look at it, though, Sam, would be this: is that maybe you'll cover more things, and you can get the immune system even in better shape by cross-pollinating, so to speak. But the thought is, the hypothesis for the study is that those people who get the mixed vaccines will not have as robust an immune response as those who get 2 of the same shot.
Is there anything that I can do to make the vaccine most effective for me, like boosting my immune system with vitamin supplements or pre and probiotics?
So a lot of discussion on that in social media, a lot of anecdote, looking at zinc, looking at vitamin C, looking at echinacea, and looking at vitamin D, D as in David. There is some literature suggesting that vitamin D, when your supplements, vitamin D supplements, when your levels are low, okay, and your levels are low by going to the doctor. When your levels are low, that getting your vitamin D levels in a healthier range or in a therapeutic range will help your body fight against COVID-19, but will not affect the vaccine efficacy. And there's no data to suggest that I'm aware of that vitamin C or zinc or other types of supplements or probiotics or prebiotics will help you enhance the COVID-19 vaccine. I would say this though, I would tell your question writer that the best thing you can do is to stay healthy. Otherwise, we know that a healthy body and a healthy mind support better health. And there's a concept of resiliency, in geriatrics and in internal medicine, that the healthier you are, before you get sick, the better you'll do afterwards. And there's some literature suggesting that vaccines are better handled by your body when you're otherwise healthy. Now, Sam, I know you're waving to me outside of the screen here, and that we're running short on time. So let's take one more question, okay? And I'm going to forward this to my last slide here, key takeaways. But do you have one more question that we can go through?
What news sources would you recommend we follow for trustworthy advice on COVID-19 vaccines? And how can I mitigate some of the social media spread of false advertising?
I think in terms of false advertising and media spread, I think it's just awareness. My next slide, so slide after the one you see right now, will have some trustworthy websites and web links. So that's a nice segue to wrap things up, Sam. So I appreciate that question. What I'd like to do though for the last couple of minutes here is to go through a couple of key takeaways that I'd like all of you to read and to hold on to. I think it's possible that we can send this out afterwards as well as kind of a capsule summary of today's discussion. And I'll read these through for you. First of all, I believe that COVID vaccines are safe and are effective. There are definitely side effects, but they're transient, they're short-lived. And the benefits of COVID vaccines definitely outweigh known risks of the vaccine. Medical progress and technology will continue moving forward at a very rapid pace. And bear in mind that recommendations will continue to change. Our global struggles, our local struggles, because COVID is a local illness, will improve, but this is uncharted territory, and you will get vaccinated. You will get vaccinated. Keep using trusted resources for updates and recommendations, but continue the COVID precautions. Vaccines are one way in which we will stay healthy together and one way in which we will get back to normal, but it's not the only way. COVID precautions are really, really part of that. And life will return back to normal at some point. It's just that the timeline's uncertain. We just don't know. So here are a few resources for you, online resources. There's the AMITA Health COVID-19 Safe Care page. Okay, there's the Levy Senior Center's homepage. the Chicago Department of Public Health and the City of Evanston's Health and Human Services departments provide a wealth of information and many links. And there's, of course, the CDC's COVID-19 Resource Center. I think all 5 of these links, Sam, okay, to your question, your last question for me, have great information on their pages, but also links to trusted sources that each of us can follow as things continue to change with this world that we call the COVID-19 pandemic, and as we all get vaccinated from COVID-19. Here are a few resources. If I can plug the AMITA Health website, just because I'm part of AMITA Health, there's a bunch of practical information there in terms of health issues and staying healthy during the pandemic. Many links to how you can maintain COVID precautions both at home and when you go to the doctor's office or the hospital for testing and such. If you were to go to AMITA St. Francis Hospital down the street from the Levy Center, or one of our other 19 hospitals throughout the Chicagoland area. So I'd like to give a special thanks as we wrap up here to the Levy Senior Center Foundation, to my new friends there. Thank you for hosting today, and thank you for inviting me to speak with all of you. The leadership team at the Levy Senior Center is phenomenal as well. AMITA St. Francis Hospital, thanks to all of you. Thanks to everyone who supports successful aging, and a great shout out to everyone who helps promote COVID-19 vaccination efforts. I love this photo here on the right-hand side from Reuters. So again, you see the full photo credit there on the bottom right. This is a mural that I saw in a COVID article in Reuters last week. A mural of an artist in India. And I think it's just a really, really neat image and, example of what each of us is going through here in Chicagoland and throughout the world. It's just really, really neat. So once again, thank you, all of you, for joining today. I hope this was meaningful for you. I hope you all got something out of it. And I hope that this discussion promotes more conversation. And those of you who might be on the fence to get the COVID-19 vaccine, that you'll sign up and get one. And if you're not ready, that's okay too. But I hope that each of us can continue to stay safe and continue COVID precautions today and in the future. So thanks, everyone. Sam, I'm going to send it back to you to wrap up.
Thank you, everyone, for attending today. As Dr. Max said, there are a number of resources that you can reach out to. I know there were many questions that may not have been answered directly, but please reach out to those resources for more information. You can also reach out to the Levy Senior Center Foundation. They have resources for anyone that may not have access to internet or smart devices. Additionally, you will receive a follow-up survey via email after this for your feedback. And again, we appreciate everyone for attending, and have a great rest of your day.
Thanks, everyone, for joining.